Welcome to Kibbe on Liberty. Everybody in this country is talking about Medicare for all. I thought it would make sense to talk to Troy Lanigan, a Canadian fighting against government controls in healthcare and all of the rationing and waiting lines and bad things that happen in that country. Check it out. Troy, welcome to America.
Well, great to be here. Great to be in this studio finally that I've seen so many times. Now I'm sitting in it.
Yes, and you brought me a gift direct from Canada, which I'm pretty excited about. Tell me about what this is here.
Crown Royal. So this particular whiskey that we refer to as rye back home actually won a World Whiskey gold medal in 2016. So when that happened, it was impossible to find this on the shelves because people were just grabbing it. But now you can get it, and so grabbed a few. I've seen so many whiskeys enjoyed on this show over time. I thought, well, I better, in the spirit of being a Canadian guest, I better bring a bottle down to share.
And where are you based?
So I live in British Columbia on the West Coast, lived there most of my life. I actually did spend a year in Virginia at one point. I've lived in a few other spots, but I've always returned to the West Coast. I live in the capital, Victoria, which is near Vancouver.
Okay. And you're the founding president of a fairly new organization called Second Street.
Right. Yeah, so for most of my career, I've been involved with taxpayer advocacy work, 26 years with the Canadian Taxpayers Federation. Decided it was time to leave, make room for the fella coming in behind. But you know, Matt, you go to conference after conference and have conversation after conversation, and we all agree that we that support the ideas of limited government need to tell more stories. And so we came up with the idea, what about creating a think tank that was dedicated just to telling stories? And if we disciplined ourselves only to tell stories? And so we wrote a business plan out for secondstreet.org. And it's dedicated to telling stories, the impacts that public policies have on people in a real and profound way. So, for example, on something like healthcare, I could tell you that the average wait time for a surgical procedure is 19.8 weeks, is what it is, an increase of 113% since 1993. Or I could tell you the story of a young woman named Laura Hillier. Laura has a very treatable form of cancer, leukemia. A very active young woman. She was involved with musical theater. She sang beautifully. She had a lot of friends. And when her cancer crept up again at the age of 18, she went onto a wait list. And unfortunately for Laura, there was only 5 of these procedures that were done, and all she needed was a stem cell procedure. There was only 5 done in her hospital region a month. Well, there was 33 people in front of her, and she didn't make it. Laura died, 18 years old, vibrant woman, had no reason for this to happen to her. And if you look at the news stories, you'll see hundreds of her peers, young people, signing this young woman's casket with these messages about how she was loved and how beautiful she was. This is morally wrong. And we'll get into this discussion that, oh, we've got to have equality and we've got to have equal access and we can't let people pay for this out of their pockets. We on our side have to be just as morally outraged at what governments are doing in something like healthcare by rationing it. This young woman didn't need to die, and there's others on wait lists like this around the country. And the idea that we want to import this or export it, I think we better stick to the whiskey and not the healthcare system.
Yeah, that's my beef, and I'm a huge fan of rye whiskey, and I recently discovered that one of my favorite American ryes turns out to actually be sourced in Alberta, Canada, Whistle Pig, and we've drank that on this show as well. One of my favorite bands, Rush, is a Canadian export, but I don't want your single-payer government-run healthcare system exported to the United States. And we're shockingly having that conversation right now. Like, I think almost every single Democrat running for president today has endorsed some version of Medicare for all, and there's various flavors of this, and it's usually more about the specifics. And I thought that the story like you just told is what first got my attention. You and I were speaking on a panel in Sydney, Australia, and it was like the Australian Libertarian Society and the World Taxpayers Association. But so few of us tell stories. We parse Elizabeth Warren's numbers, right? And it's like, what is it? 20 trillion? Is it 30 trillion? Like, how much is this going to be? Not appreciating that there's not a single person in the world that it can even conceive of, or frankly care about what $1 trillion is when it comes to healthcare.
Right.
It's ultimately about whether or not your daughter gets the care that she needs in time for her to grow up and live a vibrant life.
Right. Yeah. Yeah. And there's lots. There was a survey done showing that only 26% of people could tell you how many zeros were in a billion.
Yeah.
And yet we use these numbers all the time. And when I come down to this country, they talk in trillions. I mean, they are completely meaningless figures.
Yeah. Yeah.
But if you know, you can relate, you can see some young woman who lost her friend that's writing a message to her on a coffin.
Yeah.
What's more tangible? What has more meaning? What hits you in a more profound way? And so I think we on our side, we're too logical. This has been going on for a long time. There's great think tanks, there's great materials, but we've got to start connecting and telling these stories in more real and tangible and meaningful ways that connect with people. And so that's what we're trying to do is, you know, go out and talk to people that are on wait lists, for example. What are their actual experiences, and tell those stories, and then push them out, and see that as a means to hopefully affect change and build constituencies that go, something's wrong here, this isn't working. So,
well, let's take a step back, and I suppose we should take 2 steps back and try this delicious rye. It's sort of haunting me here. Cheers. That's beautiful.
It's nice.
It's beautiful. So let's assume let's give people sort of Canadian healthcare 101, because certainly some of the people listening understand that the Canadian system is kind of a single payer system. But tell me how it works.
Well, there is both private and public healthcare. A lot of things are private. Dentistry is private. Pharmaceutical drugs are private. Medical procedures that are not deemed medically necessary are private. Plastic surgery, for example, you can go and pay out of your pocket for procedures like that. The catch is that anything that's on the government's list, and it varies a little bit from province to province, that is deemed medically necessary can only be paid for by the government by law, which means it is illegal for you to take out of your pocket to pay a doctor for a medically necessary procedure, like a stem cell transplant we just talked about at the beginning. It is illegal for a doctor to bill a patient anything over and above what the government would have on its pay schedule. So in a nutshell, that's how it works. Now, there have been some gray areas, orthopedics, knee surgeries, these sorts of things. So some private hospitals have popped up. But you can understand why any private sector investor would be hesitant to set up a hospital under that scenario.
Yeah.
Some still have. And there are many cases, depending what the government of the day is in any province, they may actually contract out some procedures because they're backlogged in the public system. But then a government changes, it becomes more militant that we can't have any of this extra billing. It's immoral that someone pay out of their pocket. And all of a sudden, fines are being issued for any doctor that bills outside of the public system. So
By the way, there's a similarity there. A lot of the regulations governing Medicare providers, hospitals, doctors, you're either in or you're out, but you can't do both. You can't both take Medicare patients and below market Medicare reimbursements and then provide procedures outside the system. You have to choose one or the other. And that seems to be one of the characteristics of a sort of a rationed government system, is that if you allow for people to sort of leave the system when they need to, it undermines the whole process of cost control, right?
Right.
What we would call rationing, but what they would call cost control.
Right. And so, well, I mean, basically you have a monopoly, right? And you have all these problems that are typically associated with a monopoly, whether it's a private monopoly or whether it's a public monopoly. And so I think, one of the most powerful indictments, and we did some of this work, if you look at our site on 2nd Street, is that people ultimately vote with their feet. They leave the country. And this is the most powerful indictment of the system. Our research shows through, and this is Statistics Canada data, I mean, it's government data, 217,000 people left the country for care in 2017. That's like 600 people every day.
That's huge.
Huge.
Yeah.
And so, I remind American audiences that you multiply that by 10 when you're, comparing it to the United States. So imagine us here if you had a circumstance where 6,000 Americans were leaving the country every single day to seek care in another jurisdiction. So that to me always is the most powerful indictment. But I don't know why. My challenge is, and my frustration is, why can't we create the big constituency at home to change all that? Because we see all these statistics. You talk to people, they understand, but there's this pathology almost that like you've got to be, you cannot, people can't pay out of their pocket, that there's something morally wrong with people being able to pay out of their pocket. And so this is why we've got to meet them on the moral argument rather than just the economic argument, and say, no, it's not. It's morally wrong to put someone on a wait list.
Yeah.
And their only option, if they can afford it, is to go to another country. And not just the United States, but people going to Mexico, Thailand. We had a conversation, Matt, I'm not making this up, about a woman that was going to China for a procedure because she wouldn't have to wait as long as she would in the Canadian system. So this is crazy. And we can get into it. There's been a number of efforts to try and move this needle.
Yeah. I want to tell some of those
home.
stories because I spent some time on your website watching various patient stories, and you guys have done a great job of, I'm sure it's not always easy getting a patient to tell their story because healthcare, when you get sick, it's such a personal thing, and you have to be willing to sort of open yourself up to that. But I'm thinking about this dilemma because you have 216,000 people a year leaving Canada to get the health care they need because the system has failed them. But the majority of people, most of the time, happily are not facing some sort of catastrophic healthcare crisis. And I'm thinking of Jim Carrey, one of your exports, thank you very much, was on Bill Maher's bragging about how awesome the Canadian healthcare system was for him. And I was thinking to myself, that's because you probably never really needed it.
Right.
Because the crisis is not about basic care. The crisis is, I have cancer, and I just got a 2-year waiting list to be treated. But tell some of these stories if you can.
I'll tell you the first one actually. Very simple. A woman needs hip surgery. She's in a lot of pain and discomfort.
This is Jenny, right?
This is Jenny's story. This is the first one we did that we released on the site. A very active woman. I mean, she enjoyed hiking. She has grandchildren. She spent a lot of time with them. started to experience pain, was identified that she would need surgery, and became more and more immobile as time goes on. And the system told her it would be 1 to 2 years before she could get treatment. And so we tell her story, we show it. She can't put on her socks. She needs a device to put on her socks, and we take her all through it. We then put out her story, and the local media picked it up, and we like to take the people who tell these stories onto the media where we can, or to appear before a committee, whatever the case may be. And she tells her story. It gets the attention of some officials, and lo and behold, guess what happens? The 1 to 2 year wait becomes
magically.
A matter, magically, no coincidence, becomes a few weeks. So this is politics governs this system. When you turn the system over to politicians, whoa, what's going to happen? You're going to get political imperatives running it.
Who's got the juice to get in line in front of somebody else?
The squeaky wheel gets the grease. You know, like no members of the Toronto Raptors are going to wait for 2 years to get a procedure done. Wink, wink. I mean, come on. If you're connected, if you can raise your hand or make some noise, as the case of Jenny shows. There's a great story at home in Vancouver in the 80s when they started construction of the Vancouver General Hospital. They wanted a visual so that people could see the government's commitment to healthcare. So there's these two 13-story buildings go up, and they constructed them, and the government of the day looked great. Well, guess what? They sat empty for more than a decade before they were finally filled. I mean, this is crazy. It's like a Potemkin village on 13th Avenue in Vancouver. Oh, look at our commitment to healthcare, these empty buildings. This is disgusting. It's because politics are governing this more than it is people's lives, people as consumers. We have to think of them as consumers. If I have heart disease, and you know, I've had my own story. I know you have a story as well with healthcare. I went to a session at the hospital that helps heart patients day-to-day living and everything else. And someone raised a problem with the program, and the doctor running the program says, well, you should go talk to your member of the Legislative Assembly about this. To which I thought, this is so messed up. Like, why would you go talk to a politician? You're the doctor, you're standing in front. Like, the relationship should be between the provider of the service and the people using the service. But when government injects itself, a whole other bunch of priorities take place that have nothing to do with that relationship between the... I mean, you wouldn't think of having the government in between a relationship if you're going to buy a record, or if you're going to buy a car or a pair of shoes. So why is healthcare different? Or to that extent, why don't we have, if you applied it in other areas of life, why don't we have food care? Why don't you get a card from the government called a food care card, and you go in and just get the food you want and leave? And if you explain that to anyone on the street, oh, that wouldn't work, and they'll give you all these reasons why it wouldn't work. Okay, well then why is healthcare any different? And this is, this is what we're trying to do, is create, through stories, through narratives, through these kinds of examples. I think they're far more powerful in motivating and moving people in a different direction than this idealism that does not work, that it's somehow free and available for you anytime.
Well, it's sort of like, going back to the food analogy, apparently you have the same thing in your country. We have something called mandated benefits, and it's always a political football as to whether or not your disease and your treatment makes the list or doesn't make the list. And it's a fight in state capitals. It's a fight, unfortunately, more and more in our federal government as to what's covered, what's not, under Medicare and Medicaid, mandated benefits under Obamacare. And imagine applying that to your grocery list, and some faceless, gray-suited bureaucrat somewhere in some agency is going to decide that canned tuna is on the list, but your favorite thing, whatever that is.
Right.
In my case, it would be rye whiskey. Rye whiskey's not making the list,
Right.
and that's a moral outrage as well. But we need to get people to understand that the only people that really understand what your healthcare needs are you and your family, your doctors, the people that you know and trust, and the people that support you. Imagine being totally disconnected from the bureaucrats with lots of power who would decide that for you. And that's every one of these stories that you talk about. Somewhere, somebody really smart decided that Jenny didn't need hip surgery because it wasn't a priority vis-a-vis something else. And maybe it was because there wasn't enough budget.
We have to build empty buildings.
Yeah. There wasn't enough budget. Like we're going to build these cool buildings. Some other element is more politically influential.
Right.
Like these are all like the sort of wicked stuff you would read about the Soviet Union, not Canada or God help us, the United States.
Right. There's plenty of wealth in our country to provide for everybody.
Yeah.
Right. But it just goes to show what government interfering in the system, and probably a lot of the people that set up this system, it's only been going on since the 1960s, are very well intended.
Yeah.
I don't deny that they're well intended, but God, look at it. It's not working. And so there's more and more discussion around it. And what's happening too, we can get into this discussion a bit, is a lot of it's now just going to the courts. So there was a decision in 2005 called the Shirley decision, in which the courts made a good decision by saying that a right to a wait list is not the same as a right to health care. And the courts themselves said that people were on these wait lists and in some cases dying. The Supreme Court of Canada said that. That's not me, the advocate saying it. The problem for Shirley was it was a Quebec decision. It only applies to, this is a whole other subject matter, but the laws are a bit different in English and French Canada. Mm-hmm. So now, finally, I mean, several years later, 14 years later, this case is just wrapped up in English Canada. It's actually in British Columbia before the BC Supreme Court. Dr. Brian Day is the gentleman's name. He runs a private clinic called Kibbe, and he's brought forward the case to allow himself as a doctor to extra bill, but more importantly, to allow patients the right to pay out of their pocket. So these arguments, in fact, by the time this goes to air, we may have a decision on that. I'll certainly send it down to you. So it's I think it's patients going to the courts, doctors going to the courts. This unfortunately has been the vehicle, because politically nobody will touch it. I mean, of course, the left-leaning political parties at home support it, but even the Conservatives won't touch it, unfortunately. They don't have the courage. Sometimes there's little things nipping at the sides, like a Conservative government or province might contract out some services, but the big substantive issues of myself, my children, my family should have the same rights as our cat.
Yeah.
If my cat needs a procedure, Joe, we can take him to the vet and pay out of our pocket and have that procedure done on Friday. But if my son or my stepdaughter need a procedure, you get in line and you're told, like Laura Hillier was, that I'm sorry, we only do 5 a month. You're number 33 on the list.
Let's tell one more story. Let's put some faces to what you just said, because another video I watched on your site was an interview with a gentleman who finds private solutions to people in line.
Yeah, Rick Baker. Yeah.
But he talks about a 4th grade girl who with a fairly basic ear infection, and tell that story, because it tells us what we're really talking about here.
Yeah, and I encourage people to listen to Rick Baker tell the story. This is economic development in Canada. Rick Baker runs a business, and his business is helping Canadians find Medicare outside the country.
Yeah.
And there are other people that do this as a business. This is crazy. Like a business is to help people leave the country. But this young woman, she's in the 4th grade. She can't hear out of one ear, and she goes to Vancouver Children's Hospital. They explain, well, we can get you in 4 months. 4 months come, same thing again. I'm sorry, another 4 months. Take it or leave it. And by this stage, you know, she's in a lot of discomfort. She's having trouble learning. You know, it's a lot of discomfort.
She can't hear in class.
She can't hear in class. She can't learn properly. She can't function. She can't interact with her peers. All of this stuff. So I think after the 3rd 4-month delay, they go to Rick Baker, who then gets them in the next Friday into Bellingham, just across the border. A doctor there looks at the ear and says, oh my goodness, this is far more serious than we realize. A week later, she's down in Seattle. And he says, we're not going to, it's not just the infection. We need to go in and save this young woman's life. And, you know, Rick points out there's at least half a dozen cases that he can document where he factually saved lives because he was able to find private sector solutions for...
Basically, her simple infection spread into her
because
brain,
of timeliness, right? So it went from a simple ear infection into something that...
would have killed her.
Could have potentially, Yeah.
If she had kept waiting, the consequences were essentially life and death.
And thankfully, and so... You know, here again, I mean, if my family had a medical emergency, I would have the means to get them help in the United States. But so all of this argument about the poor and equality and everything else, how is it helping? It's the poor people, the lower income people that are most affected by wait lists because they can't necessarily, well, they're less likely to be one of the 217,000 that are able to get on a plane or get in a car and go down to the United States or Mexico or fly off wherever. So it's those people that are disproportionately hurt by the status quo that forces them onto these lists with even fewer alternatives than others might have.
So it seems like a reasonable response to wait lists and global budgets and low reimbursement rates for the public system. I'll accept the left's terminology. The public system is the government finance system. It seems like an utterly reasonable response that our side always has. Well, at least let's let people leave the system if they can afford to, or if a provider is willing to provide a service, fee-for-service kind of situation. But that's specifically what you're fighting with in Canada, and we fight here as well because the designers, the people that really think that they could centrally plan the provision of health care, think that leakage undermines in our country we used to call it the global budget. Clinton Care and Obamacare had a global budget, and you couldn't really let people outside the system because you know markets get in and start to screw things up.
Yeah. In almost all democracies, there are options for people. So we have a very knee-jerk cultural reaction. Everything becomes like it's either the Canadian system or it's the American system. And then the American system is demonized by all the politicians and everyone. Oh, we two-tier American healthcare. Like this is always used. And people down there, they have, if they don't have their credit card, then they're going to die because they're all of this. My response to that is then don't adopt an American system. I mean, every other country in the world virtually has private alternatives, or certainly the private sector provides alternatives in different ways and in different measures that provides better outcomes for people.
Yeah.
So let's not talk about the American system as, you know, what we say in debates. Let's talk about the Swedish system. Let's talk about the German system. Let's talk about Australia's system, New Zealand's system. All of them have different ways of using the private sector, some more than others. that at the end of the day provide better outcomes for people and provide people with choices. And then there's just the moral argument. Government tells me how to spend half my income already. They forcibly take it from me in taxes. Now they're going to tell me how I can spend the other half of my money.
Yeah.
Well, you can't. It's illegal. You cannot spend it on healthcare. Well, who the hell are you to tell me I can't spend the other half of my income, which I've earned, on things that I want? So I can take my cat down to get a procedure, but I can't take a loved one. So yeah, I mean, there's obviously the economic argument and the measurements and the outcomes that are produced in other countries. But I also think there's more the moral argument about, should I have the right, the freedom to spend my after-tax dollars how I choose?
Yeah.
And, you know, that has to be. You can spend as much as you want on whiskey, on gambling, on on tobacco, on marijuana now, whatever. That's great and that's fine. But you cannot, by law, spend it on a medically necessary procedure to save someone's life. What the hell kind of crazy system are we living under?
I love comparing. So I have 3 cats, and they are hardcore Randian libertarians. And in case you didn't know this, cats are libertarians, and dogs are sort of ideologically suspicious. Let's just leave it at there, because I don't want to open that can of worms. But I spent a fortune on my cats, and it's because they get the best health care probably in the world, and I pay first dollar for the care that they need. But you alluded to this. I spent some quality time in a hospital fighting cancer, like I think 18 years ago now. And my wife just pointed this out to me in the context of this mythology that Americans are dying in the streets because of lack of access to health care. And it's ridiculous. I shared a room with a homeless veteran when I was, and I had like the best health care. I had Blue Cross gold-plated health care, the kind that Barack Obama demonized as a Cadillac plan. And I was sharing a room with my stage 4 cancer with a homeless guy on Medicaid. And so this idea that somehow people don't have access to care in the United States is ridiculous. But more importantly, to the point about my cats, like the idea that you can't spend outside the system. I wanted to quote something. I was thinking about you and watching your videos, and I remembered this quote that I used in a book that I wrote quite a while ago at the height of the Tea Party. Now I've lost the page, but there's a great speech that Robert Reich gave around the time that he became part of Barack Obama's transition team, and he was speaking at Berkeley. And Robert Reich, of course, you know who Robert Reich is. He's now kind of a rock star, progressive, technocrat economist who has taken to video himself. The other side always beats us on this. And he was talking about what a candidate running for office would say about healthcare if he was being honest. And I'll paraphrase here because it goes on for a while. But he says, first of all, young people, healthy people, you're going to pay a lot more. And everybody in the audience applauds. Second thing, and I'll read this because it's shocking. This is a quote from Robert Reich. If you're very old, we're not going to give you all that technology and all those drugs for the last couple years of your life to keep you maybe going for another couple of months. It's too expensive, so we're going to let you die. People applaud. And then he goes on and says that, you know, we're gonna use our marketing power through Medicare and Medicaid. Even before Obamacare, Medicare and Medicaid made up more than 50 cents on the dollar of every healthcare dollar that Americans spent. We're going to use that to bully drug companies into lower prices. But oh, by the way, that means less innovation, less life-saving technologies. But that's a system. So as a technocrat, that's going to redesign human life from the top down, they're well aware of the fact that people aren't going to get what they need, but they've just decided that we're going to spend this much on healthcare and we're going to run it from the top down. And you and your doctor, you don't get a choice anymore because that's not good for society as we see it.
Right. Well,
that's evil.
Yeah, of course. It is absolutely evil. And they are implicit with people's pain and suffering and discomfort. They're implicit in the death of people, frankly. I don't know how else to put it. The system only will give you or provide you what they allow it. So if you want to invest in more innovation in the system, well, you've got to make a claim on taxpayers. This is ridiculous. Like, what other business? If you want to innovate in almost any other line of work, well, you go out and you raise capital and you do that. But if you want to expand a cancer screening program, you've got to go and convince politicians the case to make a further claim on taxpayers. And I mean, this is rationing. And the outcomes are clear to be told. So,
and yet, we in the United States are about to import this idea, I think Bernie Sanders and Elizabeth Warren, other candidates love to point to the Canadian system as this is what we would like to achieve in the United States.
Yeah, and I was going to add that there's debate now. We just had a federal election in the country, and two of the parties are talking about doing what they've done for healthcare, doing it with the pharmaceutical industry. One party is openly wanting to nationalize all pharmaceuticals. And I don't know the exact numbers, but there's been some academic research around this that shows that the number available would be cut in less than half as they, again, ration that. So isn't that great? Like, let's take everything that's wrong with these long wait lists and people like me that need, drugs to live. Let's ration that. That's a great system. Like, how can you not? And so fortunately, many of the provincial premiers that have to cooperate as part of this plan, because healthcare is delivered by the provinces, a couple of them are standing up and saying, look, I think we've got a lot to figure out with delivering basic healthcare before we start getting into rationing and distributing pharmaceuticals. It's a crazy system. Central planners figuring out union contracts, but also the number of Q-tips in all of these hospitals. This is absolute madness. I thought we learned these lessons after the fall of the wall, that these centrally planned systems don't work, whether it's the entire economy or for a particular sector like healthcare. And yet this idea of equality is so powerful that they not only talk about it, but they continue to make the case openly and proudly that we'll expand it to other aspects of the economy. We got to fight back against this stuff.
Yeah.
And anyway, that's...
Well, the good news, if you will, is that the narrative right now in the United States is that, Kamala Harris just pulled out of the Democratic primary, and she was a big advocate of Medicare for all. I recall, I think she was one of the original co-sponsors of Bernie Sanders' legislation. And more important maybe is that Elizabeth Warren, who was very much considered the front runner, is collapsing because she's the narrative is she made the mistake of putting the details of her Medicare for all plan out there, whereas other people like Bernie, it's more of a statement of religious faith. We're going to provide care for everybody, and he doesn't really explain how exactly that's going to happen. But she put a price tag on it, and she put specifics on it. And I think a lot of Americans, particularly senior citizens that are in Medicare, they weren't given a choice, but they're there, and they understand that growing the populations that depend on these services inevitably leads to some form of rationing. And getting back to Robert Reich's point, someone like me, stage 4 cancer, fairly exotic cancer that was only cured because of a fairly new innovation in chemotherapy. So imagine me in a ration system. Am I worth saving? Would that treatment even exist under that system? And senior citizens are thinking about this, and Jenny's story is important here. Like, was it worth fixing her hip?
Right.
Because those are the questions that the bureaucrats ask. So I do think we can. I think we can win this argument, and I think one of the lessons maybe that Elizabeth Warren teaches us is that instead of some sort of global replacement vision of a free market in healthcare, we just allow a little competition. We allow a little bit of choice. We allow patients that need something that the government can't provide to go purchase it on the market.
Right. And that shows why the number of people leaving the country is so powerful, because they are reaching out to the marketplace, in effect, by voting with their feet, and they're not going to wait. Their lives are worth more than that. I feel sorry for the people that can't afford necessarily to do that.
Yeah.
That's where the real crime is, because there's no alternative but to get on the back of that wait list and hope that you get there.
The irony of the quest for equality is that poor people suffer the most under the system.
And one of the problems, Matt, is that the solutions are often misdiagnosed, right? So often people look at this, oh yeah, wait lists are terrible, blah, blah, blah. But the solution is more government, right?
Yeah.
This is what the politicians offer. Oh, well, we just, we'll replace those guys that are in power now. We'll put more money into the system and we'll manage it. We'll manage it better. And a lot of people buy into this. But we've increased spending at a greater rate than population growth and inflation for decades. And the wait lists continue to go up. Connect the dots. It's clearly no amount of money is going to solve the problem, because the system itself and the incentives in the system are inherently flawed.
Is it so in the United States we have a so-called three-tier system where there's always a middleman, and it's usually either a government program like Medicare or Medicaid, or employer-provided insurance, which is treated differently in the tax code. Therefore, it's flourished and sort of crowded out direct relationships between patients and doctors. There's always a third party making a decision, and that creates an insane amount of bureaucracy and an insane amount of waste, essentially, to feed that bureaucracy, and also makes it so that doctors and patients have no idea what something costs. They don't, because they don't pay the price. I've actually tried to use a health savings account before, and I'll ask a doctor, well, how much is that? Right. And they have no idea, because they're stuck in a system where a rational allocation of resources is not a thing that they even think about.
Right. Yeah. Well, they have no idea what the cost is, because it's only measured in inputs, right? You pay this many nurses this price tag, you pay this many doctors this amount of money, and it's thrown at the system, but there's really no measurement. So private facilities that have outsourced some of the treatments and billed back, they didn't know what to bill these private facilities, because they'd never actually measured in many hospitals the cost of a given procedure. So it was the private sector that was telling the government in many cases, well, this is what it costs to do this procedure for your knee or your elbow or whatever the case may be.
Yeah.
Because they don't measure these things. They don't know the cost. I mean, the patient doesn't know the cost. That comes through their taxes, obviously, but even the administrators in these government hospitals often don't know what the costs are. So, yeah, I mean, it's just wrought with.
Yeah, and in our system, there's all sorts of cost shifting. So, if you're not on Medicaid, which is the lowest reimbursement for procedure X, Medicare is a little bit higher, but it's still below quote market. There are no market prices, but
that's a problem. There's no market prices.
Then there's what like your employer's insurance reimburses, and then if you're not in any of those systems, you pick up the slack. So if you walk in to purchase a procedure in this country, the prices are insane. So I think it's important to point out that when we're talking about patients choosing and market competition and being aware of the price of things, we're not, at least I'm not in any way endorsing the current system, because it is completely screwed up by all sorts of interventions and regulations and distortions that has nothing to do with what I think should be a proper healthcare system.
Right. Right. Well, and this is this is the path that we're on.
Right.
Right.
But I just slipped into economist speak.
Right.
And I'm failing, and you should scold me right now. We need to tell stories. Where can people find the stories, some of the videos that you guys have produced?
So our website is secondstreet.org, and there's stories on there, but there's also narratives that we tell, and we have some fun with. One we didn't get to is we had a couple of us. I wasn't part of the video, but got up early one morning and slipped across the U.S. border. Because of course we're told that our system is so vastly superior to Americans, and no one would use that for-profit system. Slipped in the car, really went across the border, went to the first hospital we found on the other side of the border in Bellingham, Washington, drove through the parking lot, found a dozen Canadian license plates, including, interestingly, one plate in a doctor's stall. So even some of the professionals are working down in the system. Because again, they too are rationed in the system as to the number of procedures that they can perform based on what the administrators tell them that they can do at any given time. So again, it's people voting with their feet. By, they are going to find alternatives to live, to be out of pain, to avoid all that discomfort. So secondstreet.org is our website, and we want to build it out, and we'd like to do more stories, especially as you come up into your election cycle, so that we can, I think Americans need to hear about this experience too. What I hear from politicians in this country often is a lot of theorizing that, oh, it's free, it's accessible, and all of this stuff, but it's important to understand what it is in practice. And you've got an example just, you don't have to go far. You've got a neighboring example right north to the border to learn and to understand, because this has been going on since the 1960s as it faces more stress. And of course, we didn't get into this whole issue, but it's also undercapitalized, right? Because it's all pay as you go as the population ages. We've got to fix the competition model, but we've also got to create systems of savings, right? Yep. Because the system is going to be really strained as the population ages, and the tax base isn't there to fill those gaps the way it was. So, there's a lot of pressures on the system, obviously, but the biggest one, and the one that we really want to focus on, is we've got to break down this monopoly. We've got to allow for systems of competition in the marketplace. It's just like if we buy food or buy shoes or anything else. Why did these things work? Why are there no shortages? Connect the dots. And we've got to apply those same lessons when it comes to people's health care and their lives. And so through the stories, through the narratives, I think we're going to start to do that. And hopefully some of these court cases and other things that are going on will have some success as well.
In the meantime, we need to make sure that we Americans don't screw up our system so much that Canadians no longer have that escape valve, right?
Yeah. Or we'll be going to China, or we'll be going to...
So keep your Medicare for all, and we're going to pursue more market-based solutions here.
Good stuff.
Okay, cheers.
Cheers, thank you.
Thanks for watching Kibbe on Liberty. By now, you know this is the most important event of your week. So make sure you subscribe on YouTube. Click the little bell so you get notifications. Kibbe on Liberty, mostly honest conversations with mostly interesting people.